Okay, so let's talk about the types of wounds. So we have got four types of wounds. Number one is clean wound, number two is clean contaminated wound, the third one is contaminated wound, and the fourth one is the dirty wound. Clean wound is that wound in which there is no opening of the cavity, no opening of the viscera. So it is a clean wound. The examples of clean wounds include hernia surgery, thyroid surgery, breast surgery, or an orthopedic surgery. Heart surgery also comes in the category of clean wound. Clean contaminated wound is that wound in which a cavity is opened. It is actually a clean wound, but you contaminate it. The surgeon actually contaminates this wound. The examples of clean contaminated wound includes gastrojejunostomy, hepatic jejunostomy, pancreatic jejunostomy, uncomplicated appendicitis. This one is important because they usually ask about this one. Uncomplicated appendicitis is an example of clean contaminated wound. The other examples include biliary enteric anastomosis or gallbladder surgery with spillage of bile. In clean contaminated wound, there is minimal spillage. Okay, the third wound is the contaminated wound. In contaminated wound, there is bacterial spillage. So the examples include perforated appendicitis, diverticulitis, duodenal ulcer perforation, perirectal abscess, appendicular abscess, and an infected laceration. Infected laceration is actually a contaminated wound in which there is bacterial spillage. The fourth wound is the dirty wound. Dirty wound is that wound in which there is purulent heavy contamination. Okay, so the examples of dirty wound is acute cholecystitis with spillage of pus, a traumatic wound, and a bowel obstruction with perforation, fecal peritonitis, and an abscess. These are all the examples of dirty wound. Now let's talk about the surgical site infection. Surgical site infection is that infection which occurs within 30 days of the surgery. But in implant cases, the infection which occurs at the surgical site within 1 year of the implant, that is known as surgical site infection. The most common organism isolated from surgical site infection is the Staphylococcus epidermidis. But in intracavitary surgeries or infrainguinal surgeries, the most common organism which causes the surgical site infection is the E. coli, and it is followed by the Klebsiella. So let's talk about the percentage of surgical site infection in these various types of wounds according to Bailey and Love. So if you have given the prophylactic antibiotic to the patient, what will be the percentage of surgical site infection? And if you haven't given the prophylactic antibiotics, what will be the percentage of surgical site infection in these four types of wounds? So with prophylaxis in clean wounds, the percentage of surgical site infection is 1%. In clean contaminated wound, it is 3%. In contaminated wound, it is 6%. And in dirty wound, it is 7%. Just remember this like this or in this fashion: 1, 3, 6, and 7%. You can remember the last one as less than 9%. So this is the method in which you have to remember 1, 3, 6, and 7% with prophylactic antibiotics. Without prophylactic antibiotics or without prophylaxis, the percentage of surgical site infection in these four wounds is like this: 1% in clean wound, 5 to 10% in clean contaminated wound, 10 to 20% in contaminated wound, and up to 40% in dirty wounds. So you have to remember this side of the table like this: 1, 5 to 10, 10 to 20, and up to 40%. 1, 5 to 10, 10 to 20, and up to 40%. So this was some points regarding the types of wound and the percentage of surgical site infection in these four types of wounds with prophylaxis and without prophylaxis. Thank you.